All right, now to talk to us about health care and some of the other provisions in it, Eleanor Clift from Newsweek joins us. Eleanor, welcome to the Young Turks.
Glad to be with you. Good evening.
Always good to have you. All right, so first, before we move on to this abortion question that you wrote about, there's no hope, right? That's it. Public option gone, vaporized.
Well, I wouldn't say totally gone. They're coming up with some sort of a gimmick where Olympia Snowe has proposed the notion that you would have a trigger that the insurance companies would get, 5 years to make good on their promises to curb costs, and if it doesn't work, then you would have a fast track towards a public option.
Sure.
Kind of thing that sounds great on paper, but very hard to deliver in the future, I would think.
Well, no, it's absolute nonsense. You nailed it. It's a gimmick. So, Eleanor,
it's a gimmick to get her vote, basically.
Who cares about her vote? They have 60 votes. Anyway, look, I'm despondent today, to be honest with you, Eleanor, because it turns out Obama never meant a damn thing. He made the deals with those companies, the healthcare companies, from the get-go, and our eyes did not deceive us. He's not going to go back on those deals. He never intended to pass the public option. I mean, he has the perfect scenario here, 60 votes in the Senate. He's got the overwhelming majority in the House. He knows he's not going to get any Republican votes. He has nothing to lose.
But he doesn't have 60 votes in the Senate because Kennedy's seat is vacant.
I know.
And unless they really decide, I don't know, maybe they will fill it.
Do you know how easy it is to fill that seat? You know how easy it is to fill that seat? I mean, you're telling me Barack Obama can't call his very good friend Deval Patrick and say, hey, let's make a minor exception here and fill it till January. I mean, of course, if he wanted it.
I don't know. I mean, you may be right. I don't know that Deval Patrick can do that on his own. I think he needs the legislature. And they're supposed to be meeting next week, and I would hope that they would do it. I don't think it's a guarantee.
But that's besides the point, because no matter if they had all that lineup, if they had 70 senators, they still wouldn't do it, because Obama never had any intention to do it in the first place. I mean, how am I seeing that wrong? He made the deals with the insurance companies.
I'm not that disillusioned yet. I'm not that disillusioned yet.
There's no other. I don't see
the public option is gone either. So
now, Eleanor, frankly, I don't see that point of view.
Yeah.
Okay, because I don't see how. What did he make the deals with all those private healthcare companies and intended to screw them over?
No, but the condition there is not, I don't think that those deals were explicit that you couldn't have the public option.
Well, that was my understanding based on some reporting. Now, the reporting could be wrong, right? But then we have the reporting today that he has clearly said they're thinking of 3 different ways of killing the public option. And one of the options is not saving it. It's just how they're going to kill it. So, without a fight, it's terrible.
Well, I guess, I don't see how you lower health care costs without the public option or without some sort of non-profit pressure on the insurance companies.
Yeah,
and I thought that was the ultimate goal of this, that was actually before covering everybody, that was the primary goal, was to bend the cost curve, which is what they have been saying. Well, he's going to address the joint session of Congress on Tuesday. I think he's got to be a little clearer about what he's supporting and what. Then I don't think he could just get up there and state principles.
Yeah, I think it's going to be more pretty words, and I don't think it's going to matter at all. So let's move on to another provision here on abortion. Here's another place where the Republicans will probably get their way, because it's not like they're a nearly insignificant minority, but they still run the place. So what have they demanded on the abortion issue, and what looks to... Well, let's start there, and then we'll figure out if they're going to get their way.
Well, what the Democrats want is an abortion-neutral provision. In other words, that the public option would not, or the health care reform would neither mandate coverage for abortions nor deny it, that it would be basically up to the marketplace. And 80% of private insurers cover abortion services. And if a public plan comes into being, people who buy into it and pay with their own dollars should be entitled to receive abortion services. And what they've got to do though, is figure out a way when the government is funding health services for people that taxpayer dollars are banned by law to fund abortion services. And so creating that firewall, and opponents are saying it's impossible to create the firewall, and supporters, advocates of reform say public hospitals do it all the time. They get state funds and they do abortions. And so, but it's, already I saw on Fox News somebody was arguing that there was an abortion premium on any kind of on government sponsored health care.
See, the problem,
so an abortion premium is just, it's two words and it sticks in your head. Whether it's wrong or right, it's one of those effective scare sound bites.
the problem is on our side we have logic and facts. Where you say 80%, and I saw that stat in your piece. I think it's a great stat that I had not seen before. 80% of private insurers offer abortion coverage, right?
Right.
And obviously the public option is not subsidized, so it's not really government money. It's our money. We're paying premiums. We could either pay a premium to a private insurance or to a public insurance.
That's right.
And it would be our money. But logic and facts are irrelevant because the Republicans on Fox News Channel, as you rightly point out, will scream from the rooftops, they're paying for abortion, they're paying for abortion. So that puts us on the clock. How long before the Democrats cave in on this issue?
Well, if there's no public option, then they don't have to cave.
That's true. That's true. Without a public option, it's irrelevant. Yeah, that's a great point.
Right.
So my guess is the Republicans will continue to insist, even when there is no public option, that somehow we're paying for abortion. Right?
Right. They'll still say it's a backdoor way to pay for abortion. Yeah. And you know what's interesting? The Hyde Amendment, which of course was pushed by Henry Hyde, formerly of Illinois, longtime representative in Congress. He's been dead and gone for a while, and it's been 30 years since he pushed through that amendment. And no Democrat has seriously ever tried to change it. I mean, abortion is one of those third rails now that, touch it and you die, and Democrats are always afraid of riling up the other side.
Right. That's so, in my opinion, Eleanor, that's so close to true. We're talking to Eleanor Clift of Newsweek. It's actually touch it, and it's not that you die, it's that they think they're going to die. In fact, the people who support pro-choice is an overwhelming majority in the country. But the Democrats, of course, don't have the spine to fight for any of their beliefs. So why don't they fight for this one, where the Republicans are going to scream even louder?
Yeah, the thing is, a lot of politics is about intensity, and the Democrats have the numbers on their side, but they're sort of soft, squishy majorities. And the angry minority is out there. They're at the town hall meetings, and I'm afraid they're the ones that are going to show up to vote a year from November. And
if Obama
a quiet panic is beginning to build in Washington among the Democrats about what might happen next year.
Well, if Obama and the Democrats continue to completely demoralize their base, that might actually be true. That's the really depressing part. And isn't it funny that we've gone from what they call the silent majority to now the shouting minority?
Right. Oh, that's I shouldn't laugh, but that's very well said.
That's what's happening here. All right, Eleanor Clift is from Newsweek. Really appreciate you joining us today.
All right. Thank you so much.
Thank you.